is Inga Paulson, if you don't already know, and I'm here to discuss just kind of a brief overview of my research evidence-based practice essay. So the name of my essay is Routine Self-Care and the Mitigation of Burnout. And this essay essentially investigates the PICOT question: are nurses who do not participate in self-care activities compared to those who do participate in routine self-care activities at a greater risk for burnout? In my essay, I had defined self-care activities as weekly or monthly mindfulness interventions such as yoga, deep breathing, and meditation. So the reason that this is important to the science of nursing is because there are 4 times as many nurses as there are medical doctors in the United States. And unfortunately, although we are the backbone of the healthcare system, nurses rank highest in burnout rates amongst all other healthcare professionals. So it seems that obviously, we're not really being considered here. And in addition to that, we already know that chronic stress, that chronic inflammation in the body, dampens our immune system, leading to all different kinds of disturbances such as metabolic syndrome, hypertension, irritable bowel syndrome, depression, and even suicide, amongst many other problems and potential complications. So since we are the backbone, we do need our own health prioritized so that we could take care of everybody else in this country as well, and also to provide good quality health care. So essentially, I had used burnout and nurses, not COVID, to find the best research articles based on what I'm looking for. So my key 2 findings were mindfulness-based stress reduction as well as reduced turnover rates. So essentially, in all of the research articles that I had been investigating, we had found statistically significant differences in groups that had mindfulness-based stress reduction implemented either weekly or monthly, in comparison to those that did not have that in the control group. Now, the studies that I had looked at virtual mindfulness sessions as well as in-person mindfulness sessions. And it seems that it didn't really matter whether it was in person or online. And it also didn't matter the kind of meditation they were having, such as there was gratitude and then heartfulness meditation sessions that were compared in another study. And again, statistically significant differences. For example, with a significance of p-value 0.001, 2 different nursing new grad nurse cohorts in a residency program were compared. One group had weekly mindfulness interventions either online or in person. The other one did not, and with the statistic significance of 0.001, they were able to find a huge difference in reported burnout rates, stress rates, and they even noticed a reduction in the chances of them resigning from their position. So that leads me into reduced turnover rates. In regards to most of my research, they did note the substantial correlation between burnout rates and turnover rates, and there being a huge correlation between those two. If burnout rates are statistically drastically reduced, then we may also be able to reduce nursing turnover rates. So some limitations are basically the exclusion of individuals that are going through current traumatic events or have chronic illnesses and stress. I believe that this makes the data not as generalizable. And in conclusion, I would like to suggest the implementation of routine staff mindfulness-based sessions in any kind of healthcare facility in order to improve the mental and physical well-being of really all healthcare workers, but in this case nurses, and also improve the quality of care that they can provide for patients. All right, thank you guys. Have a good day.